what you're learning in school will translate into the real world if you allow it to, if you're the one that implements it. Because there is going to be a culture in private practice that it depends on where you are, right? And what practice you end up in, where they may not have what you learned. But you are the latest and greatest of dental hygiene coming out. So you have the latest information to know what the latest standards of care are. So many instances where family are in the hospital, and I watch the providers in the hospital look at the patient like just like another room number, because it's going to turn over anyway for another patient to come in. And there's like, we lose the humanity aspect. And we are very privileged that we're in a job of service that actually we get the most interaction. We actually get the chance in dental hygiene to talk to them and actually bring humanity to who they are.
A tale of two hygienists.
And welcome back, listeners, to a Tell Two Hygienists podcast, episode 538. I am your co-host, Dave, and I am here with Jess. And Jess, did you know that around this
I know.
season in May, I graduated in 2012? And did you know that I had no idea that around this time I was going to propose to my wife, or rather find my life partner?
I
And
love.
yeah, and it's so weird to kind of like reminisce a little bit about this time in the season. And I always have a heart for dental hygiene schools and students and faculty, because it's just kind of like it's a full circle. Um, and just like, can you tell us a little bit about who we're gonna be having today as our guest?
Oh, I'm going to tell you a little bit about the one, the only Kevin Lopez. Now, let me tell you, how you set the scene was perfect, Dave, because this time of year is a time of change, a time of endings, a time of new beginnings, and a time that is going to change your life. And when I met Kevin Ohashi Lopez, my life changed. Now, if you could be a fly on the wall and watch how we met, you would agree. There was an implosion, explosion, all the plosions of everything when we met, because he's so wonderful. And at this time of May, when graduates are coming to the end of their school career and starting a new profession and holding all of these changes in the space for change, I was thinking, who would be the best person to have come and talk about how to hold space for change? And that'd be Kevin, because he graduated in October of 2019, and we all know what happened after October 2019. But he has also held he's worn a lot of hats in the profession. In education, in industry, and in clinic. And that's why I wanted him to come on, because school is an environment that often gets compared to quote unquote real life, that they're not the same. Well, they might not be the same, but their clinic wasn't useless. And Kevin has done a really great job really implementing standards of care and practicing in a way that brings the best of clinic into real life. Kevin, thanks for being here with us.
Oh, thank you for having me. This is so cool. When I was a hygiene student, a tale of two hygienists, like this podcast was everything. And so like to know that like I got the emails like, can you be here? It's like, how do I say no? Like this is an automatic yes. There is like, especially when you texted me first, I was like, there
I
is no
did.
way I'm gonna say no to Jessica. And then I realized that where I'm going. I was like, oh, this is an absolute yes. I feel like I'm on like the Oprah of dental hygiene podcast right now.
That is high praise. And I feel like we're
It
getting to that
truly is.
status with having you on the podcast. So thank you for being here,
Oh,
Kevin.
thank you for having me.
Tell us a little bit about your transition from school into the space in which you're at, and the advice that you have for students in this space.
Ooh, so like you mentioned, I graduated towards the end of 2019. So we know that, at least for me as a hygiene student, I was not academically inclined. I'll be very honest. I think I was like, I mean, and
I
many students, no, I swear, you can ask
well,
my faculty.
I just want to take a beat here, because a number of dental hygiene students out there are feeling like, well, I wasn't an A student. I wasn't like the 4.0 student. And I'm going to say this, I'm going to say it loud and proud. You do not have to be a 4 student to
You
be
don't.
a stellar clinician.
You
Hmm.
absolutely do not, and that's why I share that because I was not the valedictorian. I was not like what cum laude, magna cum summa cum laude, or whatnot. But there, I've recognized I've gone really far in my career. So I always share. It doesn't necessarily mean that you have to have the 4.0 to
Mhm.
excel. It's a mindset. It's opportunities and having manifestation come in. Like all these good energies come your way. I think with students, for me at least, when I was a student, I understood that I had to work really hard to memorize everything or to learn the processings of school, clinic, protocols, sequencing, like all of that combined. And then I had to translate that to my national boards before graduation. And then I
Mhm.
had to translate that to my law and ethics. I had to translate it all like multiple times. So eventually I was like, well, I guess I do know this. So why do I keep hearing real world or like in private practice, you're gonna experience this? I was like, well, then why am I not doing it here? All the while I
Mhm.
realized I actually was. In private practice, you're not gonna take blood pressure. I was like, yes, I am. There's
Yes,
a blood
you
pressure cuff
are.
right there. Yes, I am. Right. And so I think for students is like remembering that what you're learning in school will translate into the real world if you allow it to, if you're the one that
Mhm.
implements it, right? Because there is going to be a culture in private practice that it depends on where you are, right? And what practice you end up in, where they may not have what you learned, but you are the latest and greatest of dental hygiene coming out. So you have the latest information to know what the latest standards of care are or is. That's my biggest advice. Like, you guys are probably going to be better than me now. I see my students now, and our curriculum has changed. I teach at the school that I graduated at. Certain things in the curriculum have changed. And I've been part of that team that gets to help implement new things, and that's rolling out into private practice. If the student or the now graduate allows it to, they're the influencer of change.
The
Yeah,
power.
and it's so important to note too. I mean, I've been like I mentioned, I graduated 2012, which I've been in the game, right? And before that, I was also an assistant, so I've been in the real world, back to school, all that fun stuff. But I don't think you ever stop being a student. You know what I mean? Like I
No,
still think that to this
Mm-mm.
day, we all learn new stuff, and Jess and I reminisce a lot about like every single guest that we have in this podcast, and how we are always learning something new each and every single time. But I do love what you said, Kevin, which is the mindset, right? Like you have to be the one to be like, well, I am in the real world, even when you're in clinic or in school, and oftentimes say to yourself, I'm gonna be the change. I'm gonna be the person that's gonna evolve the whole philosophy of just learning to implementing. Right. And I used to be a mentor for hygienists, and I will mentor hygienists that have been at it a lot longer than I have. And it was a little weird because obviously I had quote unquote less experience than them, but I knew something that they didn't. So even them are, they're students. Now I have to ask you, when it came to you going back to school and teach, was it like a full circle moment where you're like, oh, I remember these days? And I remember like, like being in the corner of this room and just like stressing over this. And now I am the instructor. I am talking to the next generation. Or did it feel more like, Scrubs remastered 20 years later, revamped season of like dental care or dental
well,
hygiene?
okay, not 20 years. I ain't that old. I'm still cute.
And-
Okay. But definitely, I felt like it was full circle. It was surreal, not full circle. I think I'm just now starting to feel the full circleness, but it was surreal to be back in a different space. And I had came back multiple times before I got hired on as faculty to do their board reviews through a board preparatory. And even then, I was like, wow, like, wait, do I really know what I'm doing? Mind you, again, I wasn't valedictorian or anything, so I wasn't sure if I knew what I knew. And Jessica can attest to this because she's seen me do board reviews at her school. It's a lot of information.
A lot of information.
And I was like, okay, that part is full circle.
I tell my students, I say, at this moment, right now, you are smarter than me, but you will never be more experienced. Remember that. But when you are studying for boards, you have so much information in your brain, and you have the latest and the greatest information at quick recall. And
Yeah.
I wish it would stay that. I wish it would stay
I
at quick
think
recall.
luckily for me, because I'm constantly doing it, it does here at the
That there you
school.
go. I think there's a
But
lesson there.
like even this morning, I came into lab with my students, and the other faculty with me were the same faculty who were in my very first day of hygiene
Mm.
school. And now I'm on the other side with them wearing the instructor scrubs, the instructor lab coat, and it felt so weird being I was like, "Wait, am I really supposed to be here?" And then I had to sit with it, and then they would ask me questions, and I'm giving my feedback on my experience in private practice and how, like, I was able to translate everything I learned into private practice where the pieces fit, right? That's where I was like, "Oh, I think this is my full circle. I'm here now."
Mm.
It's a little early on in my career, I feel. I really feel that 'cause like, I'm like, are you sure? Are you sure? Like, really, are you sure?" 'Cause there was once upon a time, I remember being in the back corner with a blanket, um, just trying to stay awake with my coffee, and now I'm the wide awake, like, "Let's do this. Let's get our grasp right. Let's do instrumentation. Let's understand things. Let's understand biofilm." It was like, "Okay, I think I understand. I've gone full circle now being here at the school." It's weird. It's so weird, but I love it.
What I love about your full circle moment is recognizing that you are an example of how to implement the things that at one time you're like, "Am I gonna ever remember this?" And you are keeping it fresh and you're keeping it in front of you in order to translate that into patient care. What
Yeah.
are a few things that you hear that aren't a practical or implementable in quote unquote the real world that you have found vital parts of your clinical practice? Lay it on
Ooh,
us.
I am spicy, and whoever hears me, if you wanna fight me, go ahead. Imma say it.
Bring it.
Imma stand on this soapbox until I die. Disclosing.
Ooh, the good one. Kevin, that is so good.
Disclosing. I will die on a hill to say that that disclosing is integral, it is vital, and it is a non-negotiable in my practice as a clinical registered dental hygienist.
Tell us more. Why did that not
Mhm.
fall off your cart when you went into practice?
Okay, I'll be honest, it
Or
did for a second.
I was
It
gonna
did
say,
for a
or did
second
you
Mhm.
because I was when you're coming in with zeal and then you're coming in at like, "Okay, I have the power to save the world one smile at a time because 'cause I'm a new graduate. Let's get this and let's get this money." And then you're here, "Well, that's just how we do it here." Right?
Mhm.
And you're
Yeah.
like, "Well, I wanna keep a job, so I'm not gonna try to push back too much." Like, you're gonna have to learn how to read the room a little bit. But then I got
Mhm.
really intimidated and just didn't, and everybody was like, "Oh, because there's not enough time to get everything off." I was like, "Okay, that's fair." And then I was like, "Wait, hold on. I'm not getting everything off. Does that mean I'm doing an actual full service hygiene for my patient? Am I actually
Mm.
providing full therapy to remove all the disease-causing pathogens in that moment that they trust me to do so,
That they're paying you for? That
that
they
they're
have an
paying me
expectation of?
for?" They have the expectations,
Oh.
right? So
Mm.
for me, I made it non-negotiable because I what they're like, "Oh, patients don't wanna see the purple lips or then learn how to disclose properly." There is retraction systems, there is techniques. Oh, they don't wanna see the stuff lift on their teeth. Then get it off. That's our job. That's debris. That is disease-causing pathogens, that is disease-causing bacteria. We need to take that off. We
Gotta
were just talking
go.
about it's got to go
It's
because 'cause they're
got to
nasty,
go.
so they gotta go.
The nasty. Get 'em off. I've been thinking about this because I would dare say that most patients are not familiar with disclosing, that we have created
Mhm.
an expectation that is far below our standard of care. And I'm curious on what the patient perception or experience has been as you have described why you are turning their teeth purple.
Initially, they didn't understand it, and I had to relay or reflect it and replicate it to that of going to the doctor. If the doctor is requiring a diagnostic like an MRI, there's a difference between a contrast MRI and a non-contrast MRI, but both are necessary. Contrast means something's going in the body to contrast when it goes under the imaging system, right? That is my disclosing agent because there's something I'm supposed to see. If I do a regular MRI, which is like just a clinical, like, I think it's there, that
Sometimes I
does
can see
nothing for
stuff,
me.
but
Sometimes
I
I can
can't
see
see
stuff.
everything.
I can't see
Mhm,
everything. So I think
mhm.
that's where they understood. And then because I was intentional with like my sequencing, intentional about what kind of equipment or armamentarium I needed to provide said service. And I was lucky enough to have a doctor who listened to me, but I
Mhm.
also had to learn how to speak at a certain way. This is where motivational interviewing comes in, right? And we're hygienists. We are
Oh, you mean
professionals and
something that you
experts at
learned in
this.
clinic?
You know,
Motivational
right?
interviewing?
Okay. And you motivational interview your doctor and find and meet them where they're at to invest
Hmm.
into you, the hygienist, and
Mm.
that way everything comes off. So a picture's worth 1,000 words, and there's also power in language. That's something else that we learned here in school that I was able to translate into my private practice career. I think that's one thing. And patients, they didn't like I knew not to use the words dyes or stains because I'm in California, so dyes is a huge thing here. So I
Sure.
always said we're trying to get a bacterial sample. We're doing a
Oh,
bacterial analysis. So what that means is it's going to change color so I can see exactly where the bacteria is. And I want you to see this so that way I'm not telling you to brush everywhere, which you're supposed to, but I'm going to tell you focus on key spots. And we're not
where
always
we
going
have the
to tell
highest
you that if
contrast.
right, and then
Right.
it's not just brushing. What if you're doing great brushing and I just need you to work on interdental cleaning?
Mhm.
Hmm.
Which yeah.
Or vice versa. Vice versa. Sometimes there's biofilm actually on the brushing and they didn't even realize it,
Uh,
right? On the brushing
mm,
surfaces. So this
mhm.
is my patients love it now. I hate when office consultants bring in this that report card paper that you're supposed to do. I've gone through so many of those and it's like it doesn't work. The pictures do. Take a photo.
Hmm.
That is your baseline. You can't just take photos and then there's nothing there. Patients don't know what material output necessarily looks like. We do.
Right.
Hmm.
When it's disclosed.
When is this closed? Kevin, that's such a good point. How do you disclose? Is it with tablet? Is it with like
Uh,
we're not supposed to say dyes, but with the droplets? Like, how do you do?
mhm. So I personally use the gel when I was in private
Okay.
practice. I've also used the cotton tip applicator that has the self-contained disclosing agent in it already, like the two tones or the
I found
Hurry
the liquids just way better, like a gel
I
or a liquid
so
versus a
yeah,
tablet.
the tablets. If I mean, but here's my thing. I will again meet the practice or the doctor where they're at. If all they have at the moment is
Mhm.
tablets, I will use all of that just so we're not buying things until we need to, because then I can help them understand. Like I'm here to help you invest when it's time to invest, but let's utilize what we can. Meet them where they're
That's a
at
good.
to find the value.
Yeah, such a good point. Just with drops. I
Mhm.
mean, this goes back to school. I'm gonna bring out my trauma here, and I
Oh
do
Did you
not
no.
dye your
disclose. And it
shoes?
could be because of this. No, so like the air tip has two buttons, right? Water and air.
Yeah,
And
uh-huh.
so I was a student, and if you can believe this, a little anxious student in clinic, and I think I was running behind for some reason. It's time for me to disclose, and instead of putting water to dilute the liquid that I had, I put air, and it's just my patient had a very brand new white t-shirt. This was my first patient. This is how
Oh,
my hygiene clinic career started. My very first patient had like the
That's a
whitest brand
choice.
new
Kidding.
what
Kidding.
I basically did tie-dye on her
whoops.
shirt. I feel so bad. And so I
Yikes.
think since then, I just, like students and clinicians, those who are like, okay, I'm convinced I'm gonna disclose now for sure because Kevin brings up a lot of good points. Slow down a little bit, right? Because I think I'm gonna start doing that moving forward because I am the hygienist that takes the before and after photos. And you're right, like it just shows so much more. And one of the things that I do that I never stopped doing since hygiene school is OHI. How
Mm.
can I expect my patients to do well? They could be doing it, but it doesn't mean that they're doing it properly. And you can't really effectively show them that technique without disclosing or photos. And so I always tell the patients, I don't want you to stress about being perfect because my job is to pick up what you weren't able to get at home. But what I will do is give you feedback like a personal trainer on how to do it better and how to maximize your time and how
I
to
like that.
be more efficient.
Mhm.
I was like, think of me as your personal little dental trainer. Like we can kind of give you feedback
That's
as I
awesome.
go to the appointments. Yeah, but I gotta be honest with you. Like every you said this close, and immediately I was taken aback with that white shirt that looked like tie dye, and the patient's very like petrified face of like
My
I
being.
white
think that
shirt.
I think one thing that I will say is that as educators, though, we will, of course, we need to teach you how to do it, right? Sometimes it's just like we assume that students know how to do something. What I love about being a faculty member is at least who I work with, I love being able to see all of us calibrated. And when I go to different schools, when I was like jumping for board reviews, I see that the intention, right? And I always remind students, I think one thing they'll always hear about me is I tell them to be intentional from
Mm-hmm.
instrumentation, but be intentional about oral hygiene education. It's not just grabbing a goodie bag. It's being intentional with
Mhm.
disclosing. How are you going to isolate that? If patients are worried, if they're wearing like white, because you're doing an overall appraisal. These are all things that you learn in school clinic that you're gonna have to do for the doctor in private practice anyway. You are the bird's eye view as much as you are that like tunnel vision hygienist.
And yeah, you got to get the big picture and you also got to look at the minutia. And meeting Dave where he's at, I think a gel would be really good for you,
Yeah.
Dave. It's very
And put the gel on
contained.
the toothbrush. Like the
Yes.
toothbrush that they're going home with, put it on
Yeah.
there and then brush it on them so you can gently rinse it out or leave the water in there, have them swish and then spit into a cup. And then just use that toothbrush after you've rinsed it for OHI because they're going to use it.
Yeah. Ooh, that's such a good
And
tip.
then
Thank you.
white shirts stay white. Ta-da! What is the second thing, Kevin, that you were like, people have told me they do not do this in private practice because it's a time suck. I don't have this or that or the other thing. And you're like, proved you wrong.
It's like a mix of both. It's like vitals and E&I.
Ooh, yes, yes. Tell.
Actually, let me flip that. It's vitals and extra oral, not the intraoral.
I think we
The
do a
intro,
pretty good job with intra.
I
Yeah.
think intra, like for the most part, we're skilled clinicians, so we know like we can multitask as we're scaling. We're looking around, right? But I feel like we missed the extra oral evaluation, the head and neck exam, and I made sure that stayed with me all the way through, and that really did jumpstart my career outside of private practice as an advocate and speaker, was because I had a patient complain that I did the head and neck exam after receiving consent because it had never been done to them before.
Uh,
And you're like, oh, this is standard of care. And they're like, you're a beep, beep, beep.
Yeah, essentially. Well, it didn't come to me. It went to the office manager and to the doctor, and then they're like, it was brought to our attention that they felt like blah blah blah, and I was like, okay, well, they've been here forever, so why hasn't anyone else done it?
Mm.
Like, oh,
How did
well,
you
let's not
navigate that? Because I'm sure, I know I've been in that situation. They're like, oh, you're the only dental hygienist that does this for me. You're the only
So
one. You're the only one.
I always will. I never want to throw anyone under the bus. The professional way
No,
for
you don't.
me and my
You don't like the bus
perspective
check.
is, the great thing about being a recent dental hygienist is that what we know now is that we have the ability to screen for so many different things. So I'm glad that I have the opportunity to do this for you, whatever
Oh
it
my
might
gosh,
be.
Kevin, you just nailed something for me. For all you recent grads or students that are listening, you have the best explanation if you're in a tricky situation like this. Say,
Mhm.
as a recent grad, I have new information. Nobody needs to be bus checked. That's perfect. I love that. Just like, hey, I'm a recent graduate and this is new and how would you even say it? It's not really new, but this
updated.
this this
Yeah,
updated. Oh, I like
updated.
updated
Yeah.
because we're
I
gonna
like
update.
updated.
Yeah, I like
Yeah.
updated because it's not my favorite is people are like, "That water spray nozzle thing, is that new?" And I'm like, "Since 1970 something. New."
Yeah.
So that's interesting. Yeah.
It's true.
About vitals, Kevin.
I think vitals is it's so crucial and yet so undervalued in
I didn't
dentistry.
take vitals on every patient. I would only take it on someone I was gonna give anesthetic to when I got out of school,
And so
and then
I
that
get
needed
that.
a change.
I totally
Mhm.
get the concept of it, but I guess
It
when
was
see, I love that I was like as a recent graduate or now starting to age out graduate, but the information that was provided was it's not just for that. It you definitely want to, so you understand if whether or not, there's things that you have to modify in
if you
administering
need a
anesthesia,
starting
right?
point
Right.
that's a good starting point,
But
and
for me, it was a lot about I am a prevention specialist, so I want to prevent a medical emergency happening in my chair in the event something does happen. The
yes.
dental office doesn't have all the equipment to save a patient's life. I'm not Grey's Anatomy. Okay,
I
so
mean,
like
you're cute, but
I'm cute, but I'm not Grey's Anatomy. But if you want ABC, if you love me, then just hire me. Okay. But anyway, I'm in LA, so I have to shout it out
real
where I
easy,
can.
real right down the street.
Well,
I would love. I would watch
Disneyland,
that. I would watch
I
that.
kid you not, Disneyland is right behind me right now.
I'm so jealous.
But since to say that, I think the vitals, there's more to why we take vitals than just that. It's a good starting
Mhm.
point. But in like my curriculum as a student when I was in med comp, we were, there we understand there are a lot of risks that can happen at any moment, right? A heart attack is you're a ticking time bomb if you have hypertension. If we didn't check and out of nowhere, that day happened to be the day that you have a episode or a MI
Mhm.
or a stroke. How are we going to navigate that? How can I anticipate this until it? I want to anticipate it so I can prepare in the event that it happens, or have you go straight to your primary care
Or
physician or urgent care,
you have
right?
Disneyland behind you, but I have the hospital behind
You
me.
know?
So our we share a parking lot with the hospital,
I
and
remember.
so yeah, and so often we're screening patients, and we have blood pressures that are in the high stage 2s, right? And these patients had no idea that they were at a stroke risk or a heart attack risk. And having that conversation, you're going to be avoiding a medical emergency in your chair, and you may be saving that patient's life.
Oh, yeah. It's happened in
Well,
private practice for me where I had a patient who didn't want me to take the blood pressure, and I was able to do my go around and motivational interviewing. Let's just try it, make sure it's a baseline, and maybe at the next visit, as long as everything's okay, well, meeting them where they're at. And it was high. I checked it 3 times. I was like, you probably should go to your doctor. And the next time they came back, because I didn't do treatment that day, obviously they were upset, and that's okay with me. You don't have Not everyone's gonna like you. You have to remember that too. Everybody, you're not here to please everybody. You're here to just do what you know is right. And they came back and like, oh yeah, I'm on losartan now. Thank you, actually.
Mhm.
I was like, you're welcome. So stop giving me the side eye because I just saved your life.
yeah,
Mm.
pushing through that discomfort is so important. Like, I mean, if you're listening to this right now and they're like, okay, why should I care? Why should I take vitals? I only do it when I'm numbing, right? Because I've been on that philosophy too. I want to be able to flip it on its head a little bit and say, well, imagine yourself having a medical emergency in your chair and you not having the confidence on how to handle that medical emergency because you
Exactly.
didn't take the blood pressure. So it's not oftentimes you think about it for the patient and to help them out because yes, we are preventive specialists. But what about yourself? What about you as a provider? What about your license? You are at higher risk because you didn't do the things that we teach you in school to
Mhm.
take those
Oh my gosh,
vitals, to learn how to do the
100%.
right.
Like,
So like
if I
if
was an
y-
expert witness in trial and something like this came up, my first thing would say, it is in the scope of practice of the registered dental hygienist to screen and take
Mhm.
vitals on a patient. So if I mean anything were to happen, heaven forbid, it does there are signs of negligence, I would have to say, well, it is in our scope of practice. So
You're on the hook.
you're on the hook.
Mhm.
We are required as licensed professionals, especially with everything going on in the world right now. We need to recognize that, or yes, in wherever everything with scaling and whatnot. Hashtag another
Everything, yeah.
episode. But but
Everything
everything
that's
that's
going on with your
happening,
Practice Act right now. Listen
you
up.
know, listen up. This is all within your scope of practice, and this is what separates you and makes you stand apart from any other discipline within dentistry. This is your scope of practice. Everyone else can try to do it, but it is required for you, is truly required for us in our licensure to do these things. In the moment that we said, oh, well, the doctor said it was okay, the doctor didn't pay for your license, nor is he responsible, or she responsible, or they responsible. You are. So, and that's something that stuck with me because I was like, I'm not trying to. I can't. I grew up in a very lower SES town, with socioeconomic status town, so I knew that the police were everywhere. I was like, I am not trying to get hit by the popo at any moment.
mhm.
I guess that's why it translated when
Very cautious. You're very
I'm
cautious.
very cautious. But you know what? I'd rather say ethical. I'm very
Oh
ethical.
my gosh, that is I really like that, Kevin. I really like that.
We
If
practice
we could rewind 30
ethically.
seconds, but don't edit that out. Don't edit that out. And we don't need to edit that out. But if I yes, you're ethical. And I think that's don't do something because you're scared of the repercussions. Do something because you care about your patient.
I think
You
I've
know?
had so many instances where family are in the hospital, and I watch the providers in the hospital look at the patient just like another room number because it's going to turn over anyway for another patient to come in.
Mm.
And if there's like we lose the humanity aspect, and we are very privileged that we're in a job of service that actually we get the most interaction, like
We
actual
do.
interaction with our
Yep.
patients. There's not that many out there. Usually there's usually they're trying to treat disease, so they have to go under anesthesia, or that they're too focused on one thing, so they're only focused on this. But we actually get the chance in dental hygiene to talk to them and actually bring humanity to who they are.
Mm-hmm.
I think we forget that. So that's what I learned as a student in the school. And I made sure that when I got out, that was the same thing all the way through. Because the moment that I gave up on that and just became complacent, I was not happy. I didn't feel fulfillment
Mhm.
other than, yeah, I got a check. And then COVID hit. So I was like, well, now I have no check and I still feel like I suck. When I went back into private practice and went into like leadership, it was very much like, well, we have such an opportunity. Why can't we just do it? You paid all this money and investing yourself to do all the things. Why take it out now?
Yeah,
Why take it
and
out now?
it's such a good point. I mean, other than physical therapy, I can't think of any other like professional to spend as much time as we do with our patients. That
In
comes
the
with a certain,
proximity.
And the proximity, it's
yeah.
so close. We are in a very intimate space. So like the
Mhm.
respect, we have to respect their space, obviously, but there's also um there's a way for us to educate our patients and what's needed. So if someone tells me like, no, I don't want that, I want to know why first. And I'm not gonna say,
Hmm.
oh well, why? I'm throwing my arms up in there. If
Yeah.
for people
Look very
listening, but it's
sassy.
like but it's more like, okay, is it I hope I didn't offend, like, did something hurt last time, or was it a financial cost? Let me know what it is, because I wanna know in my head, where's the value? Is there value? How can I bring value to it? Is it based on, like, cost? Is it based on feel and perception, right? Those things, like varnish, they're sticky. Okay, it wasn't the cost, so I'll give you a non-sticky one. Luckily, we have those available now, right? Or if it is cost, well, let's figure out a way to talk to practice management and be
Mhm.
the asset, not the expense to your practice.
Ooh,
Correct.
that's a good tagline. Be the asset, not the expense. Ooh, good one.
And that's a t-shirt waiting to happen, by the way, guys.
We
Um,
could have a whole line.
yeah, but here's the reality of it. Like you mentioned something so important, which is like the patients, right? The relationship and understanding and getting to know your patient and asking the why, not to like write it on the note and move on with your day, but like the why because you care, right? And obviously there's some patients that we shouldn't care more than what they care themselves with that said, right? But at the end of the day, just like, hey, tell me more. Like what's going on? Because I still to this day have patients who tell me that fluoride is poison and is radioactive and all stuff. And very quickly, if I don't know how to navigate that, it turns very like political because they probably saw too many Facebook ads or posts or whatever where it just takes one person to kind of like build that whole negativity to me saying like we don't have to do anything you want to do, but tell me more because as your dental professional, my job is to know everything there is to know about fluoride. So where are you getting this information? Where are you getting this philosophy? Because I want to know as well, right? But it's not so much like, well, let me tell you why you should do it because I know more than you do. It's just getting to understand the
It's
patient and getting
perspective.
to correct, getting to just work with them, not against them.
And this is something that is like in first year dental hygiene school. Like, I don't know if you agree with me or not. We talk about this motivational interviewing, understanding the patient where they're at, ADPI. These are all foundational things that we teach our in junior year of dental hygiene school that I feel like kind of get thrown out the door because we're so busy just
Mhm.
focusing on scaling by the time we get to because you have to take the boards.
And here's the
And
thing. You're gonna be busy anyway. Might as well be using some evidence-based resources and practices to make that busy beneficial. I mean, you're
work
gonna
smarter, harder.
work smarter, not harder. And Kevin, we are so grateful that you came today and showed us with your experience that while clinic isn't quote unquote the real world, the things that you learned and the standard of care can be taken into your professional practice. And thank you for your example. Thank you for your leadership. And we're so grateful that you were here for this conversation.
This is awesome. Thank you for having me.
That's a wrap on today's episode of A Tale of Two Hygienists podcast. If this conversation made you feel seen, inspired, or even just a little fired up, share it with a fellow hygienist or fellow dental professional. Share it with your neighbors, your friends. Share it with everyone. That is how this community grows.
Make sure you subscribe, leave us a review, and connect with us on social media so that we can keep on going with this conversation. Remember, your career, your voice, and your story matter here. We're David
And Jessica,
and until next time.
keep learning, keep laughing, and keep showing up for yourself and for each other.
This has been a production of Endeavor Business Media, a division of Endeavor B2B.